Hi, everybody. Welcome to today's podcast episode. We have an exciting discussion planned for today to share a sneak peek of iThrill webinar titled Pathways to Precision, Integrating Genetic Counseling and Testing into Cancer Care. So these webinars are being held on November 7th at 10 a.m. Eastern and November 19th at 11:30 a.m. Eastern. And you can register by scanning the QR code at the beginning and end of this video or by visiting ithrill.com. So today I'm joined by the two chairs of the webinar, Dr. Filipa Lynce and Catherine Skefos, and we're here today to share a sneak peek of what they'll be further discussing in the webinars. So thank you both so much for coming on today.
Thank you for having us.
So to start off, would you both like to introduce yourselves and share what your work focuses on?
So my name is Filipa Lynce. I am a breast medical oncologist at Dana-Farber Cancer Institute in Boston, and one of my areas of interest is in BRCA and other genes related to breast cancer.
My name is Catherine Skefos, and I'm a genetic counselor at MD Anderson Cancer Center in Houston, Texas. I see patients with all different types of cancers and tumors, but I specialize in endocrine cancer genetics and see people in the endocrine center here at MD Anderson.
Awesome. Excited to talk with you both today. So since these webinars are geared towards the interdisciplinary cancer team, including primary care providers, oncologists, and nurses, would you like to tell us why is it important for the interdisciplinary team to receive education on genetic testing?
I can get started. I think things have become more complex. It's important to understand for someone that has a mutation or an alteration in one of the genes, it's important to understand what does it mean. Not all the gene alterations mean that gene is not working properly, or that the clinical trials that we have in development are an option for that patient. It's important to understand the risk associated with having that alteration, and that's where often primary care providers, GYN, other specialties come into play, hopefully before the patient develops any cancer. And it's important as well to understand what was the type of testing that the person had, because as time evolves, tests might get better and more detailed. So it's important to know what was done in the past and see if this is a patient or a person that needs to go back and get more testing. So there's so many reasons why it's important nowadays, regardless of what is your role, to understand what the test result means.
Absolutely. I think too, we're learning more and more all of the time about different hereditary links to different types of cancers. And so what might have been true 10 years ago, has changed. And so we've learned a lot. Someone who may not have met criteria years ago may now meet criteria. And so the idea of a genetic evaluation is something that's ongoing as a patient is meeting with their primary care doctor or their gynecologist or someone like that, updating that family history, seeing how that patient may or may not meet criteria now is an important and ongoing process.
Absolutely. Thank you both for the explanation. So in spite of the importance of genetic testing in cancer, there are a lot of common barriers in integrating into practice. Would you like to tell us what some of these barriers are, as well as what some strategies are for mitigating them?
Yes, that is a big question. And of course, we're going to be talking in more detail about that during the main webinar. But, I think there are certain barriers to access to genetic testing on both the provider side and the patient side. On the patient side, sometimes we think about people being worried about discrimination when it comes to genetic testing. They worry about their privacy. There may be mistrust in the medical system for various very reasonable, things that have happened in the past that cause people to be mistrustful of the medical system. On the provider side, actually, one other thing I wanted to mention on the patient side, perceived cost of testing. Many people think that that's out of their reach, that they may not be able to afford genetic testing. On the provider side of things, just the time that it takes to take a detailed family history, the time it takes to identify a genetic provider in their community that might be able to see this patient, and just knowledge of the changing guidelines over time. Not necessarily something we would expect primary care providers to know every nuanced detail of. So part of what I hope to convey during the webinar are resources that physicians can use to help identify patients who meet criteria for testing who might receive benefit from genetic testing.
That's great. And I would just add, or reinforce something that you just said, that I see patients at the, on the other spectrum, meaning patients that were already diagnosed with breast cancer. And it's just, there's so much going on, need to meet with other providers, often chemotherapy, sometimes surgery. And now you have another test. So it's that you mentioned, Catherine, it's more time, more co-pays. What am I going to gather extra with this information that is going to change my treatment plan? So I think that there's a lot of things that we can talk about it to understand why it's still important to do it, despite these, barriers that many of them might not even be, that much barriers.
And I think too, something that is a potential benefit of genetic counseling for patients is that many of those barriers are things that we strive to address during an appointment. Talking to patients about insurance coverage and potential out-of-pocket costs for testing, talking through the federal laws that do provide protections against discrimination when it comes to genetic information, talking about privacy and how the genetic testing lab maintains a patient's privacy. All of those are things that we talk through to hopefully reduce some of those perceived barriers to genetic testing.
Great. So a lot of topics that we're looking forward to hearing more about in the webinars. So I'll ask each of you as we wrap up, what are some of the topics that you're most looking forward to covering? Things you might be particularly passionate about that you're looking forward to sharing with the audience?
Years ago, when I started practicing, I would have patients ask me, how does it affect me, the results of the genetic testing? I understand that it can affect, my family members. I understand it can affect in terms of the recommendations for surveillance, prevention. But now that I've developed, for example, metastatic breast cancer, how can that help me? So I'm really excited to show results of some important studies that led to the approval of drugs to show, providers and patients that actually having this information in hands gives additional tools to fight, cancer once there is already a diagnosis of cancer, that if a patient is not aware of it, it's just we are missing opportunities to treat or to fight a cancer. And it's not only for metastatic. We have now approvals in the early stage setting as well. And I expect that in the next years, we'll see more drugs being approved just for this group of patients. So really important. This is another field where information, is key, and it's a powerful tool that will allow patients to have access to more and better drugs.
From my part of things, I really look forward to sharing some tools and even verbiage that primary care doctors and other providers can use to share information about genetic testing with their patients. I know that genetic counselors are few and far between in many places around the country. And so I really love sharing information to help facilitate that genetic testing process in places, especially where there may not be a lot of access to genetic counselors.
Awesome. We're looking forward to hearing more about both of these topics. So thank you both so much for stopping by today to share this sneak peek into the webinars. It's such an exciting topic, and we're really looking forward to learning more. And to everybody listening, be sure to scan the QR code at the end of this video or visit i3health.com to register for one of the webinars on November 7th or November 19th. So thank you both so much again.
Thank you, Kira. Have a great day.
Thank you. I look forward to the webinars.